Hi, I'm Garvin. This telecast is on Lexapro. So why have you been prescribed Lexapro? Lexapro contains escitalopram and is used to treat depression, major depressive episodes, and anxiety disorders such as panic disorder, with or without agoraphobia, social anxiety disorder, and generalised anxiety disorder, and obsessive-compulsive disorder. So how does it work? Lexapro contains an antidepressant drug, escitalopram, and it's called an SSRI. It increases the amount of a chemical, serotonin, in the brain, which is known to be lowered in depression. So when and how do I take it? You can take Lexapro with or without food. Swallow the tablet with some water. Do not chew them, as the taste is bitter. If necessary, you can divide the tablets by firstly placing the tablet on a flat surface with the score facing upwards. The tablets may be then broken by pressing down on each end of the tablet using both forefingers. So what's the dose? For adults in depression, the normally recommended dose of Lexapro is 10 mg taken as a once daily dose. The dose may be increased by your doctor to a maximum of 20 mg per day. For panic disorders, the starting dose of Lexapro is 5 mg as a once daily dose for the first week, then increase the dose to 10 mg per day. The dose may be further increased by your doctor to a maximum of 20 mg per day. For social anxiety disorder, the normally recommended dose of Lexapro is 10 mg taken as a once daily dose. Your doctor can either decrease your dose to 5 mg per day or increase the dose to 20 mg per day, depending on how you respond to the medicine. Generalised anxiety disorder, the normally recommended dose of Lexapro is 10 mg taken once daily. The dose may be increased by your doctor to a maximum of 20 mg per day. And for obsessive-compulsive disorder, the normally recommended dose of Lexapro is 10 mg taken once daily, and again the dose may be increased by your doctor to a maximum of 20 mg per day. For elderly patients above 65 years of age, the normally recommended starting dose of Lexapro is 5 mg taken as a one daily dose. Could it interact with other tablets? So tell your doctor if you are taking or have recently taken any other medicines, including medicines obtained without a prescription. Tell your doctor if you are taking any of the following medicines: non-selective monoamine oxidase inhibitors containing phenelzine, ipranozid, isocarboxide, nilamid, and tranlycopramine as active ingredients. If you have taken any of these medicines, you will need to wait 14 days before you start taking Lexapro. After stopping Lexapro, you must allow 7 days before taking any of these medicines. Reverse selective monoamine oxidase inhibitors containing maclobemide, it's used to treat depression. Irreversible monoamine B inhibitors containing selegiline, it's used to treat Parkinson's disease. These increase the risk of side effects. The antibiotic linezolid, lithium, and tryptophan, imipramine and desipramine are both used to treat depression. Sumatriptan and similar medicines used to treat migraine, and tramadol used for severe pain. These increase the risk of side effects. Cimetidine and omeprazole, which is for stomach ulcers, fluvoxamine and ticopidine. These may cause increased blood levels of Lexapro. And St. John's wort is a herbal remedy used for depression. Acetyl salicylic acid and non-steroidal anti-inflammatory drugs, which are used to treat pain or thin the blood. And warfarin, dipyridamole, and fenprocomium, medicines used to thin the blood, so-called anticoagulants. Your doctor will probably check the coagulation time of your blood when starting and discontinuing Lexapro in order to verify that your dose of anticoagulant is still adequate. Mefloquine is used to treat malaria, bupropion is used for depression, and tramadol for pain, due to a possible risk of lowered threshold for seizures. Neuroleptics, the medicines used for schizophrenia, due to a possible risk of lowered threshold for seizures, and antidepressants. The flecainide and metoprolol used for cardiovascular disease. Clomipramine and nortriptyline and risperidone and haloperidol are antipsychotics. The dosage of Lexapro may need to be adjusted. So what are the possible risks or side effects? So very common side effects would be feeling sick or nausea, blocked or runny nose or sinusitis, decreased or increased appetite, anxiety, restlessness, abnormal dreams, difficulty falling asleep, feeling sleepy, dizziness, yawning, tremors, and prickling of the skin, diarrhea or constipation, vomiting and dry mouth, increased sweating, pain in the muscle and joints, sexual disturbances, also fatigue, fever, increased weight. Now, so lastly, can I drink alcohol while taking Lexapro? As with many medicines, combining Lexapro with alcohol is not advisable, although Lexapro is not expected to interact with alcohol. So what if you're pregnant or breastfeeding? Lexapro should not be used during pregnancy unless absolutely necessary. It is not recommended to take Lexapro and breastfeed at the same time. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.